What's up, citizens, and welcome back to the Leo Dotson Show. Hey, today we're in the middle of our healthcare series. This is part two of a three-part series on U.S. healthcare. In the first series, hopefully you will catch that if you haven't caught it already, we took a quick summary of the U.S. healthcare industry, and what we really got out of that was that we have to do something because we have gone from number one in the world in healthcare quality to number 37 and dropping, and our costs have gone from reasonable expectations to the most expensive healthcare system on the planet. So clearly we have our work cut out for us. Today we're going to examine the Affordable Care Act, ACA, otherwise known as Obamacare. Now it's important to note very quickly that this discussion, this quick analysis or synopsis of Obamacare, is going to be done intellectually, objectively, and academically. This is not the Leo Dotson Show. For those of you that are new, this is not a partisan show at all. In fact, we kind of looked as a test to see how awake and aware people are by how nonpartisan they can be. So I don't care if this was proposed by Barack Obama, George W. Bush, or George Washington. We're going to view the Affordable Care Act academically and the pros and the cons, and what hasn't changed. So let's take a look at that. First of all, what has not changed with Obamacare to what we had previous to Obamacare? Well, number one, there was some talk and discussion on legislation on putting in either a single-payer system, which they did not do, or having a government option, which they did not do. Which that means we still have, through Obamacare, we have the same providers, which are the same hospitals, the same doctors, the same clinics as we had access to before, and we also have actually only the same health insurance companies that we had before. So none of that's changed. So what has changed? What are the pros and cons? First, what are the pros? Well, some things that were problems before in the health insurance industry were things like pre-existing conditions. What do I mean by that? Well, for example, let's say that you had a shoulder injury, maybe that happened 20 years ago, back when you were dumb enough to play football and slam your body into 300-pound guys. And then let's say that you fall down the stairs and re-injure your shoulder. Well, the health insurance companies many times would deny that claim, saying that was a pre-existing condition, even though it was a completely new injury. And that really wasn't fair. That's been cleared up. That's a good thing. Also, there are no lifetime limits. For example, if you looked at your healthcare policy previous to Obamacare, it would have probably had a lifetime cap of $3 million to $5 million. Now, for a lot of people, that may not be a problem, but let's say you get a serious illness. With the cost of healthcare, which we've already talked about, are exorbitant, could easily run through $3 to $5 million. In fact, let's say, for example, you're fighting cancer. You could be halfway through your treatment, run out, hit your health insurance cap limit, and have no more health insurance. And then you eliminate your entire life savings just trying to stay alive. A very sad situation that many, many people have faced. That's not the exception. That's typically been the rule. It's a very sad state of affairs. Those lifetime limits are now removed. So that's a good thing for those of us that have health insurance and want to have access to good quality health care. There's also, we talked about free riders and such, that not everyone, even though almost all of us, if not all of us, will use health care sometime in our lives, not everyone pays for it. So even though you can't walk into the emergency room and get, say, long-term health care, you can walk in the emergency room with no insurance at all, not having paid anything into the system, and be treated for an acute injury at the time, which it's not free, so that means that person doesn't pay for it, but all the rest of us who are paying into the system now have to pay more to cover the people who are getting treatment, using up healthcare cost, but not paying into the system. So now everyone has to pay into the system. Now we'll talk about the mandate in a moment, but everyone has to pay into the system, so that does eliminate the free rider issue, which is a major problem, unless it was before Obamacare. And then also, because more people, the cost of health care is now spread amongst more people, that should reduce the cost of any of us individually on a per capita basis somewhat. So that's good. Also, kids can stay on their parents' health plans longer, and it almost runs parallel to what's been happening economically. A very sad economic phenomenon that's been happening is empty nesters who see their children go off to college, graduate college, can't find a job, and come back to the nest and move back into their parents when they're 25, 26 years old. So that kind of works out. They can actually stay on their parents' plan. For most people, that's a good thing. Also, there's been, I like to see a lot more of this, but there has been more of a focus on preventative medicine. Now, if we look at the cost, and that's one of the major problems we have, is the cost of healthcare. The cost of healthcare, if we treat as a society illnesses and disease, the longer we wait to treat it, the less successful we're going to be. The less quality the healthcare is going to be, and the more expensive it's going to be to administer. So if we can catch problems and prevent problems from ever happening from a health standpoint, not only are we a much healthier society, the cost of maintaining that health is greatly reduced. So that's a huge, I'd like to see more of that, but at least that is a step in the right direction. Okay, so what are the cons? Well, first of all, we mentioned the mandate. It's actually forcing people to go out and buy health insurance. Now, I'm not going to get into that the second part of the series. We're going to cover that in the third part of the series, so make sure you catch part 3. That will look at the Supreme Court's review of Obamacare and the constitutionality of it, which will center greatly around that mandate, so stay tuned for that. The other thing that people criticize the Obamacare is it's called socialism. So let's kind of examine what does that mean. Well, first of all, if we get a Merriam-Webster dictionary version of socialism, it says that a socialism is a system or conditioned society where the primary means of production are owned and controlled by the state. So if we look at that and apply that to healthcare, what we're really looking at is what healthcare functions which could be performed by the free market are actually performed by the government. That kind of tells what degree of socialism we're looking at. So we have some other healthcare systems within our country to look at. We can compare it to VA, the Veterans Administration. We can compare it to Medicare, Medicaid, and CHIPS, the children's health programs, and ACA, Affordable Care Act. So if we look at maybe the 4 major functions in the healthcare industry, the collections of monies to pay for that system, the providing of the care from the doctors and whoever's doing it, the control of the process, and regulation of that industry. So if we look at the VA actually collects the money. That's one function that the government does that could be done in the private sector. It also provides the care. You have to go to a VA hospital for the most part to get into the system. It controls the process and regulates it. So from the VA, it is pretty much socialism. They own the resources and they control every single one of those 4 functions in the healthcare industry. So what about Medicaid? Well, collection of monies. That's kind of joint. We do pay into a government, usually from our paychecks. We pay a Medicare portion of our taxes go to that. So the government does collect that, but you can also pay to your provider, the doctor at the time, and that money is collected and also sent off. So that's kind of a joint collection process. The providing of the care is completely private. That's done by the hospitals or the doctors of your choice. Primarily, it's not done by the government, as in the VA. The control of the process, that is government controlled, and it's certainly regulated. So if we look at Medicare, Medicaid compared to VA, it's kind of quasi or semi-socialistic. If we look at ACA, the money is collected by the health insurance companies in the private sector, so the government doesn't do that. The provision of care is in the private sector, private doctors, private hospitals, whomever you choose to go to that your private insurance companies approve. The control of the process is done with you and your doctors, but there is government regulation. So I really don't think from this perspective that the ACA really qualifies as at least a high degree of socialism. It's really just regulation. Now, what could be socialistic is the mandate. And typically, since we are a show that freedom is first, we're going to err on the side of not really getting into a mandate. So that's pretty much what Obamacare does, what it is, what it isn't, the pros and cons, what has changed, what will change. Now, we can debate further on what could be tweaked. Any program can be tweaked as we see what works well and what doesn't work so well. But really the constitutionality of the mandates, what we're going to get into tomorrow, and that really may be the crux of whether it's socialistic or not. So join us for the third part of their series tomorrow. Once again, thanks for watching the Leo Dotson Show. You are now returned to your regularly scheduled TV propaganda.